Hi, everyone. Thank you so much for attending our event today, the Industry SIG Career Panel. I'm Caitlin Stamatis. I'm one of the co-leads of the Industry SIG with SDMH alongside Trina Histon. And really the focus of our SIG is on bringing people together from different digital mental health companies, investors, academics to help think through the key issues that we're all facing together, things like reimbursement, implementation, and industry career training for PhDs. And today we're tackling that last topic in a way that I'm just so excited about with this career panel. So we'll hear from 5 brilliant, accomplished, just really wonderful humans who I think show that what a lot of us are told in PhD training, or at least what I was told, you can be a clinician or a researcher. And those are sort of the 2 paths that couldn't be further from the truth, which you'll see from, I think, just the diversity of their career paths. So we have people in clinical product and research, in entrepreneurship, at startups, and at Fortune 500 companies. And it's just really a wonderful group of speakers. So let me briefly introduce them. So we have first Dr. Arielle Radin. She is the CEO and co-founder of Bruin Health. We have Dr. Jessica Flannery, who is the founder of Translational Science LLC and a clinical product expert. And can I just ask that folks mute if you're joining or as you're joining? Awesome, thank you. We have Dr. Will Ajayi, who is, I think not, Will, are you here? Hopefully will be joining us. He is the Global Wellbeing Manager at Netflix. We have Dr. Jenna Glover, Chief Clinical Officer at Headspace, and Dr. Joe Raiker, Director of Clinical and Scientific Strategy at Joon. So thank you all so much for being here. Thank you to our panelists. And just to kick it off, I'd love to hear from each of the 5 of you. If you can talk a little bit about, your career path, how you ended up in your current role, and what your day-to-day in the job is like. Anyone itching to go first? I think, Arielle, you're first on my screen. Can I pass it to you?
Funny, you're asking me what my day-to-day is, and it really depends on, that's the question, right? Like, what does the day-to-day life look like for me?
Yeah, I think just briefly like how you got here, sort of your path, and then what you do now.
Yeah, so throughout, I have my PhD in health psychology, so I'm trained as an academic researcher. And throughout my PhD training, I had 1 foot in industry and 1 foot in academia because I always consulted for a digital health company. Throughout all 6 years of training, I was leading their clinical research efforts. And so through that experience, I really learned just how exciting and applied working in startups and working in tech can be. And I think because I wasn't in a clinical program, I was really like craving that feeling of like having impact and seeing that my work is actually making its way into the real world. I think when you're a clinician, you kind of get that on an N of 1 scale with your clients. But I was really craving that. So when it came time to graduate and do a postdoc, I decided not to do that and instead make the leap and start a tech startup company. So that's really the experience for me, was kind of getting to see a startup go from conception, ideation, being employee number 1, all the way up through raising a seed and then leaving to start my own company. So kind of had this like incubation phase with another company throughout my PhD training, and then made the leap and started Bruin.
Awesome. Yeah. And it's, I think, not every day that you hear about people who went on that journey while actively dissertating, finishing a PhD. So super.
Would not advise. So yes, but I'm very grateful for the experience.
Awesome. Cool. Let's see. Jessica, can I turn it over to you?
Yeah. Great to see everyone. Yeah, so my background was kind of different. I was pretty set on being tenure track academic path all throughout my training. I was a clinical psychology, but also in a dual program where I was doing developmental social neuroscience. So I was very busy with clinical work and fMRI methods and running lots of big studies. So it never crossed my mind to do anything but that. And I was going to be a professor. And things really shifted in kind of two phases for me. The first was when I was on my clinical residency. I happened to be in the Seattle hospital system when that was the hotspot of COVID. And I saw firsthand what was really happening in the newspapers. And I was in the inpatient unit for that rotation. And we had to do something. So we had to quickly create an intervention and implement it, even if it wasn't perfect, and just go. And that was invigorating for me in a way that my broader impacts and future statements on my grants weren't hitting. And so that really changed things for me. And then I still had my postdoc signed and was ready to go. So I still went to my postdoc. And after that, I felt this pull still to do something different, but didn't really know what was out there. So it was kind of learning that there was really rigorous, amazing research scientist positions in industry that brought me out. And I treated it as, and I talked to mentors about it, and they're like, hey, treat it like an industry postdoc. If you don't like it, you can go back. People do this now. I ended up not going back, almost did, but did not. And yeah, so that's kind of how I got there, is kind of a windy path, and I still find them intertwined quite a bit. And I know a lot of us share that sentiment that they're not just these distinct paths. Day to day, kind of wild, working with lots of different people. Yeah, working with different people, working on strategy, working into details. We can get more into that later too.
Awesome. Yeah. And that certainly resonates with this, feeling of, the path not always looking or feeling linear, but it's really cool to hear about the just variety of experiences that you've been able to touch through what you've done. Let's see, Joe, can I hand it over to you on just a brief intro of how you got to where you are and what you're up to?
Sorry, let me unmute myself. Yeah, hi, thanks. Thanks, Caitlin. And hi, everyone. Great to see you. So I'm kind of I feel like a relatively new entrant into the digital mental health space. My path, so if you had asked me in graduate school if this is what I would be doing today, I would kind of look at you like, I don't even know what you're talking about, because I didn't really know that this existed. And it may have existed in some form then, but certainly wasn't blowing up in the way that it is now. So I was on the sort of hardcore research trajectory all through graduate school. Worked in a lab where my mentor said, so I was trained in clinical psychology, did the internship, but basically told students that he would not train them to go into clinical practice, that he only trained researchers. And that was sort of what I love to do, was answering questions with data and science. And I thought that there was sort of only one way to do it. So I did all the things in the order you're supposed to do them, did an internship, got a position at an R1 tenure track, actually got tenure and promoted. And then wasn't really loving it as much as I had been, like it was fun at first. But I think I'm sort of a lesson in I think sort of what you want to do, what your passions are, what you're doing kind of evolves and changes over time. And so while I had in my head this idea that, I would get tenure, retire as a professor, I would say the last 3 or 4 years of my time as an academic, I was sort of watching a lot of friends who were going in industry. I was paying a lot of attention to what was going on in digital mental health. And I was really quite envious, wow, it seems like they're doing all the fun stuff, or at least the stuff that I wanted to be doing. And so I was really fortunate to have a few friends that were able to, help me make this transition and make this decision. And I wound up at a Series D stage company for a little over a year, which was a great exercise in sort of learning product and regulatory. And I was a behavioral scientist in a role where I had great mentorship through my manager. And then an opportunity became available in the content area that I was more familiar with, which was in childhood behavioral health at a seed stage. And so I jumped ship to there, where now I direct the clinical and scientific strategy. And it's been a wild ride, but I've loved every minute of it. And I'm happy to share anything I can with anybody who's interested.
Amazing. Cool. Joe, thanks so much for being here. And well, I'm glad I saw you joined. I was just having our panelists go around and do, sorry, that's totally on us. I just do sort of brief intros of your path to where you are, how you ended up in your current role, and what your day-to-day is like. So if you want to jump in. I don't think I can hear you. All right, let's see. I think still no. Let's see. We can do do you want to leave and rejoin? No? Okay. All right, let me see. I'll move over to, let me jump to you, Jenna, and then we can see if we can troubleshoot on the back end. Okay, sounds good.
Good luck, Will. I feel you. It's so good to be here. Thanks for having me. I'll mix up the storytelling and talk about what I do now, and then I'll tell you how I got here. So I am the Chief Clinical Officer at Headspace, and Headspace offers a full continuum of mental health options. And so we have content, which a lot of people know us for the mindfulness content, but we also have behavioral health coaching, therapy, and psychiatry. So in my role, I get to oversee the psychiatry, therapy, and coaching teams. And so I ensure like the quality of care, and my day-to-day it's very busy and it is diverse. So I will be on a sales call and then I'll be talking to the media. We just launched our direct-to-consumer coaching, so I'll have that chance. Then I'll be talking to our tech team about ethics and AI and an AI product that we're going to be launching. Then I'll be working with my actual teams, and we're rolling out transdiagnostic care to all of our providers. So it's a fun job. I work with a lot of cross-functional teams and have the chance to just play in a lot of different sandbox, but really, really love the job. So how I got here, I might be the oldest on the call, so I've got like a long career history, so I'll try to make it really short. I came out of graduate school during the Great Recession, and it was just like a hard time. Like I applied to like 32 academic positions. I wanted to be a professor, and they like froze 29 of them. So once I got out of school, I just worked like, as an adjunct at like 3 different universities, was not living the dream. I did get a job in academia. I did that for 3 years and burn out super quick. And was just like, this is not what I wanted my life to look like. So I was going to jump into private practice, but had a friend reach out and say, do you want to do residential eating disorder care? And I was like, absolutely not. Never wanted to work with eating disorders, but met the people. And one of the things I found is I almost prefer who I work with versus what I do. That's so important in your career. It was a cool group of people doing cool work. So I jumped into that, learned a ton about eating disorders, a ton about like our medical system and how broken it is in terms of reimbursement. And did that for 3 years, and then had a friend reach out and say, at Children's Hospital Colorado, we need a training director. Do you want to work in academic medicine? And I was like, absolutely not. I've never wanted to work in an academic medical center. I wanted to get out of academia. But I went there, I met the people. I'm like, this is cool. I totally was not qualified for that job. They gave it to me anyway, because I've been doing training my whole career, and I had a blast. For 7 years, I was a training director for internship and postdoc. If you can ever do it in your career, I highly recommend it. It is such an amazing thing to do. Never had any desire to be in digital mental health. Had a friend, you're going to see this as a theme, had a friend reach out and say, hey, I work for this company called Headspace. I think you'd be really great here. Do you want to apply for a job? I was like, definitely not. But I met the people and thought the mission was super cool of being able to provide access to people. And at the hospital, like we had kids waiting in our emergency room for 3 days to get access to care, 9 months to see a therapist. So just seeing what could be done in this space, I was just like, let's do it. I applied, had no experience, but sold them on me. And here I am. I started as a VP and then was promoted 3 months ago to the Chief Clinical Officer. So if you ever feel like you're not qualified for a job, apply for it anyway. And keep those network connections, because man, they open up a lot of doors. Will, I hope you got your sound back.
That's awesome. Yeah, well, I'm nervous but excited to check in and see. Oh, we have sound. Yay.
Oh my gosh. I hope you don't see me sweating too much on the camera here. Okay, wonderful. Thank you so much. And I apologize for the delays on my end. Not the best start, especially given what we're talking about. But yeah, so my name is Will Ajayi, psychology by background. it's just a quick synopsis. I started my career for the BOP, like in the Federal Bureau of Prisons, working in that space. So a lot of forensic work. And then pivoted to working. I work with quite a few veterans in that space. And so ended up shifting to working in the VA system for about 8 years or so. Really focusing on trauma and addiction. That was my energy. Personality assessment was what I studied in grad school. Kent State with Dr. Graham, but shifted into that work, the trauma and addiction space, and worked in the local hospital system. I'm in Cleveland, Ohio, so the Cleveland Clinic, a few other hospital systems, and just noticed a huge gap, right, in terms of trauma services available in the community. So started building some of that work out locally here in Cleveland. And around that time is when Kate and I got to work together, our time at YouTube and Google, supporting on the content moderator teams. And the reason I pivoted there was that a lot of those folks who were reviewing the content that sort of lives on the platforms, right, on the internet, we're just having a lot of vicarious traumatization, right? So a lot of trauma symptoms at work. And so, you know, our role, you know, the work was to build out some well-being programming for these folks. And also that opened the door into really working directly with the business. And you remember from our time together, kind of a lot of arguments and a lot of conversations for taking this idea of mental health and well-being that feels very intangible for a business and making it much more tangible so that solutions would make sense, right? And I think that sort of opened my eyes to how to leverage technology and then sort of this digital kind of space in a way to really reach more folks. So leveraging Headspace, of course, like leveraging the apps that are available, but also learning to build a business case for why well-being is a business priority, right? And how we can kind of shift in the right direction there. So I was there for a couple of years, and then I'm currently working at Netflix, the well-being manager for Netflix. So obviously working with a lot of vendors, working with the business, building the narrative, but then also delivering on it. And so that's sort of how I got here. I think I heard earlier in my dismay trying to get into this group, but you know, in terms of pivotal moments, like something always happens, right? That shifts away from academia or shifts away from clinical practice. I had 10 years of clinical practice, and so for me, scale became really, really important. How can I sort of scale the work that I'm trying to do as a clinician, the work we are collectively trying to do in this space? How can I put myself in a position to scale the work and to have larger impact, right? Because one of the biggest frustrations in this space is that you can work your tail off with a client, with a family, within the system, right? And so before we get to that space of burnout, before we get to the space where we don't feel like we're efficacious, how do I position myself? This is a question I kept coming back to. How can I position myself in the work that I do in the right space to have the right amount of impact, the greatest amount of impact? And tech has been the way to do that from my perspective. Thank you.
Amazing. Yeah, no, thank you all again so much for being here. I think even just in the intros, I hear these two themes around one, like take the call, as a lot of people have said in the chat. Sounds like a lot of you did not expect to be on the path that you have landed on, but are happy that you are. And then just like this hunger to fill that evidence to action, impact, scalability gap that I think plagues so many of us when we're either working individually with patients or in research. And so one thing I wanted to ask, and I'll open it up to all of our panelists on this one. I think a lot of times on these career panels, you know, it's what advice do you have for PhD students who are looking to make this transition? I'm curious, what are the things that, like, what do you wish had been different about the training that you received in your PhD? Like, kind of flipping it to, if you could speak to training directors out there, and Jenna, it'll be interesting to get your take on this too, as someone who was in a role like that for a while. What can training directors do to support trainees differently, better, who want to pursue paths like this?
I can add.
Yeah,
I'm thinking really deeply about this. We actually held an entire working session about this very topic at APS in San Francisco a couple weeks ago. And the presidential roundtable was actually focused on making graduate training relevant for industry careers. So I think the time is really ripe right now because we have the president of APS actually thinking about this. So one thing that I you know, when I look back, for me, I had a side hustle, right? Like I was secretly working throughout my graduate training in order to get this additional experience. And that was heavily frowned upon, right? Like I always felt like I was doing something secret that if I got found out, it would be bad. And that's so silly because I still was highly productive in my research. And it kind of made me think about how clinical training programs already have a model for this, right? Like it's understood that you need to get additional training outside of your research work. And so there are partnerships with clinical intern or externship sites where you get additional mentorship from folks who are not necessarily employed by your program. And you get credit for that. And you might even get like a stipend or paid to do that. So I think there are models for that, and I'm really curious to think about like how do we communicate this to training directors to make it clear to them that we're not like doing something that's that profoundly different from what they're already used to. It's just additional training that they can be supportive of for their trainees, and also how do we communicate effectively to them that this is additive and synergistic and not at all at odds with what they're already trying to accomplish. So that's kind of where I've been thinking is like, how do we, and I'd be really curious, like, since Jenna, you've been in this position, like how that would land for you. But I'm thinking we really need to communicate that this is not at odds with what we're already trying to do for our students.
Yeah, I would just so add on, totally agree with everything Arielle said. Like I was part of a clinical science program for 8 years as a faculty member. And it's just an interesting anecdote that when I left, you know, I said, hey, I'm going in industry. And, you know, if you ever want me to come back, because they do these brown bags and different things, you know, training sessions, and they'd have people come and talk about, you know, roles at different universities. And then because we were a clinical program, also like different clinical contexts that people would work in. And I said, hey, if you ever want anybody to come back and give a talk on, you know, what it's like to be a clinical psychologist in industry, like I'm more than happy to come back and give that talk. So this was about almost 2 years ago now. And I'm still friends with all those people. I got along very well with them. They are training directors at programs. I'm not going to say what program the training directors in, but I have still not received that invitation, even though I still talk with them and they still know where I am, what I'm doing, all these things. And I think it's a really interesting phenomenon, right? Because I've been to the same academic conferences that they've been in my industry role, like ABCT. I've seen them, and their students are still reaching out to me, and they're coming up to me, and to Arielle's point, they're coming up and they're going, thinking about like maybe going into industry. And the first thing I would say to them is, it doesn't have to be a secret. Like it's okay. It's not like a bad thing. It's actually, it could be a quite rewarding thing if it's, you know, where your passions are and what you want to do. And so I think to some degree, like it is unfortunate that students are having to take this, like, I have to go out and find these people. And I've had, you know, certainly people reach out on LinkedIn and, you know, I want to support that and mentor them and help them. But I think, I often think about why is it that I haven't gotten that invite? And one thing that I have thought about is I don't think it's like malice, right? I don't think they're like, oh, we don't like Joe anymore because he's in industry or he's a bad person. But I do think there's some level of like, not just at the level of the program, but also the accrediting agencies. Like, what are their outcome metrics and what are they, you know, how do programs get kudos for where they're sending their students and where their students ultimately wind up at the level of either the graduate program or even internships are rated on this too, right? It's like, where do your students end up? Are we asking that? Are we measuring it? Like, is industry a place that like even accrediting bodies care that students end up at? And that's one external pressure I think that could act on this to help facilitate like, hey, your students are probably going to end up in different settings than what you were trained 15, 20, 30 years ago, as the fork in the road is only two paths in clinical psychology. You either become a clinician or you go in, you know, this academic research route. But now there's multiple paths and there's lots of different ways. And I've been like super impressed in industry with how there's so many diverse things that people could be doing, from like product to strategy to research. And I think it's like getting the word out and then also like changing some of how we're measuring, like what does a successful outcome look like for a program that's training students. Those are just some of my thoughts.
Could jump in very briefly. I know this is always time tracking. So Just first of all, kudos to what's been shared so far. I totally aligned. I think, if I could go back to my program, I've done some similar stuff too, in terms of going back and having interesting conversations, being in a different space. And one thing I think we can do at the training level is really start increasing business acumen at that level, right? Because if you go into clinical work, let's say you're going into private practice, we all sort of do some version of that, right? On the side or forensics or whatever. You still need to understand how business works for our space. Like, how do you not just market yourself, but how do you make sure that the work that you're doing makes practical business sense so that you can support yourself, but also, I think, increase your reach, right? And your scope. Similar to navigating a healthcare system, right? If you understand the business practices and how the business thinks, then I think it just arms you as a clinician or a researcher in those spaces to be able to speak the language of the business to get the work done. I think if I had some exposure to that earlier, it would have made some of the rougher edges and rougher spots that are not listed on the CV, right? Like, it would have made those experiences a little bit smoother, or at least I think I would have had insight into areas of growth that I could have focused on a bit earlier. And then for us, I think in sort of industry, like, I think that there's sometimes an allergy to doing things slightly differently. But the reframe from my perspective for those conversations is, well, most people are working, right? And we know mental health at work is a real thing. So wouldn't you want to have your graduates, wouldn't you want to have, the amazing work that your program does, wouldn't you want that represented in industry so that we're, again, we're reaching people before things are a clinical emergency. We're reaching people and equipping businesses with how to support their folks better so that it's really preventative. And for me, I think that's the messaging that hopefully would land, but also I think it's honest that if more folks like us are in those spaces, I think we have an opportunity to do something pretty amazing and then help the business really support people better and earlier and sooner before things become emergent.
I'll make this so quick since I was a training director, totally +1 to what everybody said here. Two other things that I'll add. It is a huge miss that we do not talk about healthcare systems in graduate school. That I left graduate school not understanding what fee-for-service was, value-based care is. Most of you probably don't even know what I'm talking about. I don't understand how we are asking people to do science and create interventions and not asking what the cost per session would be on those interventions. Who cares if you come up with a good intervention if you can't scale it? So we're not thinking about those things. We're not teaching people about those things. We have a broken mental health system and we have the people in the room to solve it, but only if they understand how that system currently operates and how you can operate within that system or improve that system. So that to me is a huge miss. Second, AI is a disruptive technology and it will disrupt mental health care. And if we want psychologists to be on the cutting edge of leading that innovation and being ethicists in that innovation, we have to be training and having those conversations. And it is a huge miss. What will happen is it can develop in a way that is not helpful to people's mental health if we're not training students to be part of those conversations. So we are slow to adopt changes in the training world. That was my experience with it. But we're at a critical juncture that the field has changed. This is a viable place where a lot of students are going to go. And if we are not talking about it and thinking about how you scale care and how you understand cost of care, we are doing a huge disservice to our profession.
Yeah, the only thing I would add to what everyone is saying is just at a summary level of there has to be an acknowledgement that there's skills and information that people in industry have that academics don't. And I think that's like maybe a basic thing that sometimes overlooked, that like, oh, we just know everything coming in. There's a lot to gain, right? And that's why we want to really encourage that academics need to come into industry and you have these skills and be part of those conversations, be those disruptors, and bring the people in to teach not just a one-off class or info session, but like courses. Like, let's have this embedded into things that you're learning, because it's more than a one-off conversation. There's skills that aren't being taught. But I think it starts with acknowledging that there are skills that aren't being taught.
I just love all of these perspectives. I think everything from the, business, like basic business acumen, which is going to serve you, whether you're opening your own practice or a consulting company or, needing to understand who's actually paying for an intervention you develop. Like, it is wild how little, like, I got no training in that. And I think how little most of us get in that. And I think thinking through how we can really be at the forefront of some of these ways that the healthcare industry is changing, like with AI. So I guess, you know, making those system level changes are challenging. I'm hopeful that training directors out there are hearing this, that we think even, Joey, to your point, at the higher level of like accreditation agencies, right? Like how programs are evaluated and those incentives that might, I think, hold us back from promoting training around industry careers. I guess in the meantime, could you all speak to like a common question that at least I get from folks interested in industry careers is like, where do I even start? I feel like I'm trained in research, I'm trained clinically, you know, I'm interested in products, I'm interested in implementation, like what roles do I look for? How do I begin my search? And one thing I love about this panel is you're all in these different roles. Some of you are more in the clinical product space. Some of you are more in clinical operations, leadership, workplace well-being. Could you speak a little bit to, I don't know, any advice you have for trainees who are trying to figure out like, what types of jobs do I look for? What are some of the pros and cons of being in more of like the product space versus, I don't know, working on intervention development and more of like a managing other clinicians setting, anything that comes to mind there?
I can quickly start reversing the order. I started the first job I got out of my postdoc was as a clinical research scientist. And I think that was a really good first fit from academia to industry. To do research, I was writing protocols, I was writing papers. It was just doing academia in a different setting. And that felt like a really, really good first role for me. And I think within that, I was able to identify these other spots where I could be a value to the company, see that all these other things I could learn about business, I could learn about these healthcare systems. And that's how I don't even think I brought this up at the beginning, but now I work in clinical product. Now that I know all those other things, now I can speak the language of all those different stakeholders and hold those conversations. I think that for me would have been a harder spot to start because I didn't have that background. If your training program has that, or if you have other ways to get that, that's different. But for me, without that, a clinical research or research scientist role felt more aligned and there was less to learn up front. And then I could learn alongside these other components that are helpful for that role, but also these other roles that require it more from day one.
Yeah, I totally agree with all of what Jessica just said. I would also add, at least this was my experience, but I did the same thing, and I basically looked at like, what are the things that I enjoy doing the most as an academic, and that I feel like I'm the most competent in going in, because I'm obviously transitioning into this new space, this new field, and not even, and actually being really even quite naive about how steep the learning curve was going to be, having no training in business at all, and then going and working for this startup that was like submitting regulatory submissions for PDTs, and it was like, I had to learn so much stuff that I was really kind of got lucky in a sense of like, that for me was like the right strategy of like, what am I really comfortable and competent in, so that as I'm having to learn and build all these other competencies and learning how to work with all these other teams. I mean, I'll be honest in saying like, I wouldn't say like I picked starting out as a research scientist because I knew that was the role for me in industry, because like 90% of the roles that exist in industry, I didn't even know existed till I started in that role. And then I found out about all these other like types of roles that exist across like product and client success and like, just everywhere, depending on what kind of company you're at. And so I would say like, you do want to capitalize on like what strengths you can, I think, to get a foot in the door. And talk to people who are at companies that are doing those kinds of things, which I know is like a really uncomfortable thing to do. And we all hear about networking, but I really do think that it will save you a lot of headache, and really also give you a lot of perspective to talk to people at different companies that are at different stages. And that like the company being at a different stage, because I was at a Series D and now I'm at a seed stage startup, and it's like I wouldn't recommend going the reverse order. Like I was really glad that I benefited from everything I learned at the later stage company, that I was able to go to the seed stage company and feel successful. But talk to people that are at different kinds of companies that are of different sizes, that are doing you know, if it's a research scientist or a clinical scientist role, like what does their day-to-day look like? What are they doing? And listen to them to see, like, is that really the stuff that you want to be doing? And maybe it's not. And then ask them, like, are there other kinds of roles for people who have similar types of backgrounds as yourselves that they would like, you know, be willing to like connect you with that person, so you can learn about like what is a clinical science psychologist who, you know, does product design, like what are they doing day to day and that type of a thing. So
I would add that it can be helpful just to familiarize yourself with like who are the players in this space, and there's new players every day. I often send people to the behavioral tech conference page because it has all the sponsors, so you'll see a lot of different places in this space. And I would just start by, you know, like familiarizing yourself, looking at job boards, seeing like what are the different roles, because again, there are a lot of different roles that psychologists play in these different organizations. So in addition to what was already shared, that is another thing that I would do, is just like get used to like who is doing what in this space and what interests you among those different companies.
At the risk of like being ridiculous here, I very often respond to LinkedIn like messages, right? That hey, I'm a student, I'm thinking about X, Y, and Z, and I know everyone's smiling, I get it, right? Terrifying, but I will say they've been. You have to set some limits, of course, but there have been. I've now had, I think, 5 or 6 conversations that have sort of, I don't know, led to something fruitful for the folks who reached out. And I don't respond to every single one, obviously, because that's a lot. But I think for us on our end, like making the space and time to sort of give back in that way, I find it really rewarding. And it's just interesting to kind of hear, you know, where are people today? How are they thinking about this topic? And how are they thinking about showing up? And it helps me kind of stay grounded, but also it's like it's an opportunity to just connect with someone who's doing something that you think you might want to do. And I remember doing some versions of that when I was in graduate school, clearly not leveraging LinkedIn, but using a different strategy. And it was just so helpful to hear the reality, to hear the challenges, and to think about, is this something I want to do and then pursue and then be connected with, like, again, the tech conference. How do you know about that if you don't have some initial connection? So I try to make some space for that. So I apologize to my fellow panelists for putting that out there, but I'm putting it out there.
Well, your LinkedIn's about to blow up, and but I know it's so true. Like, I think, you know, I feel like we're probably all similar of, I respond to a lot of those messages too. Like, I think we all, or at least I felt like the sense of, I have no idea what the model for this is as a trainee, as a grad student, even beyond. And I want to like help pay it forward, because I feel like a lot of people like Will have done that for me. So,
Just add one plug for entrepreneurship, because I know it's not the safest path and probably not the first thing that people are thinking of when they're transitioning from academia to industry, but it's so rare that you get to like hear what that is actually like and why it would be something that would resonate for you. So for me, someone recently told me that being a CEO is like being the conductor of an orchestra. I think that really resonated with me. Like, it's not my job to be an expert at every single component of my business, but I get to work with some of the smartest people I've ever met and get to help lead them to work together towards a common vision for the future world that is like a better place than what we currently have today. And I think a lot of people go into academia and into clinical science because they have that vision, right? Like they're excited about, they probably enter in and then get burnt out and kind of give up on their vision, but they probably have this vision for this world where everyone has access to high quality mental health treatments, or maybe all of our treatments are scalable. And I just do want to say that, like, if you're crazy enough to take a leap, it is really fulfilling to actually go out and try to make that vision a reality with starting your own business. So if you are interested in that path, you know, Caitlin's been very kind to let us do these fireside chats with entrepreneurs to try to make that path more available to folks. And even if you don't go out and actually start your own company, I think having an entrepreneurial mindset, like an owner mindset when you're in companies, especially if you want to be in a leadership role, is something that is really, really important. And when people are hiring for leadership roles, that's something that we're looking for. Like, we want to know that you're going to really own this whole component of the company. So that type of perspective and training can be relevant regardless of what role you're in. So just putting a plug out there for that perspective.
And I have sort of a follow-up question on that. I love that perspective, Arielle. And Jenna, as you were talking about healthcare systems and like kind of that education gap, like where do all of you go to get this, absent these foundational shifts in our training models, right? Where can people go in the meantime to like educate themselves on the business of healthcare, on, I don't know, everything, if you're starting a company from go-to-market strategy to, corporate voice and voice of customer, like how do you learn about this outside of existing training?
So for me, there are tons of great books. Honestly, there's so many great books that you can read. And I just got into a daily practice of reading every morning to understand the frameworks. And then it's really just by doing. So like this week, I'm our marketing expert. So you just kind of learn by doing, which is really scary because, right, you're like making decisions with 20% of the information you need to actually feel confident, which I think is a really hard shift for scientists, where we really want to have confidence in what we're doing. But truly, I think if you look at the flip side of that, it's really about we're very comfortable with experimentation and like accepting the null hypothesis and moving on and realizing, okay, like maybe this failed. Why? Let's troubleshoot that. Let's try something else. And I think if you can take that like experimentation mindset towards learning and realizing that you're only going to become an expert and really get good at something that you have no idea what you're doing by actually just doing the thing, that's really the best way to learn, which is why I'm advocating for like hands-on training, actually going and working for a company during grad school. I think it's really, didactics are important, of course, but I really think the only way that you really learn is by doing. And then of course, there are always like accelerators and incubators and different programs that you can join. I was really fortunate to go through Graham and Walker's Catalyst program. They're a female-focused VC company. It's a 2-week long intensive, totally free. They don't take any equity. It's very gracious of them. And they give you everything you need to know about getting fundraise ready if you're an early stage startup. So there are definitely opportunities out there, but I think it's really just taking it upon yourself to go out there and find them.
Any other thoughts on that point, or we can jump to audience questions? We've had a couple audience questions come in, and the first one I think is super interesting. It's does political advocacy have a role in increasing scale and reach for effective mental health care? And is that part of your work at all?
Can you repeat the question?
Yes. Does political advocacy have a role in increasing scale and reach for effective mental health care? And is that part of your work at all?
I can share a little bit, if helpful. I'll give an example as well. I would say yes, but indirectly, right? So there are quite a few countries. So if you're a global company, right, you have to sort of think about regulatory compliance all the time, right? And let's say you're in a country in APAC where there are certain laws about psychosocial risks and hazards that are just country specific that you as a company need to think about, well, how do we make sure, one, we comply and maybe even go further than what the law expects in that space? And so for a situation like that, like obviously the politics behind getting a law like that to be passed and having the support, there's a lot of work that goes into that work and in terms of how you advocate for that. But I would say my work can be sort of indirectly related because when you're building a sort of intervention or a model of support to look at those hazards, to understand those hazards and how they show up in the working environment, you need to understand the nature of the culture, right? And the system in which that law was integrated, needing to understand like the intended and unintended consequences associated with that, and then making it sort of tie into the existing, again, I keep saying business acumen because it's the language, right? But how does this tie into the nature of the work that you're doing for the business? And I think there are opportunities for advocacy that are indirect, but I think really, really powerful to leverage the sort of culture that you're operating in, the society that you're operating in, the regulatory compliance laws, but tying it into this is good for the business because one, we're in compliance. And two, we're doing the right thing for folks based on what that culture and that society requires and needs. And then the push is how can we go further, right? And then if that's such an amazing thing that's happening in one region, how can we think about equity for the rest of the folks in the company? Are there ways we can kind of elevate the work that we're doing from an advocacy perspective so there's a level of parity or equity for all employees within the company? So I think there's some cool opportunities, but it does take a little bit of risk and it does take a little bit of leveraging, I think, what we learn in graduate school and what we learn as researchers, what we learn in clinical practice to then convince, you know, an organization that let's shift away just from compliance to something that's a little bit more meaningful, but packaging it in a way that I think the business can tolerate.
I'll just add, like, I think this 100% has a role in mental health and it's really important. And so we have a purpose team, and our purpose team has a social responsiveness framework that we use in terms of when and how we respond to different socio-political events. And I think that's really important because there's so many things that go on. You have to decide like what is in line with like your business goals and how that supports mental health. And so like, you know, last year we made a public statement and had a stand in terms of like all of the anti-trans like bills that were coming forward and how that impacts people's mental health. Oh, I'm sorry, my Zoom is doing fun things. But I think that's important, but I will like double down on like, you have to have a framework from which you operate, or else it just becomes one-offs. And then it's like, why are you choosing this thing versus that thing when there's so many different things, because you can't talk to everything. And so like in your space, in your company, what are the things that you're tackling and why? So there's great intentionality.
Thank you both. I'm gonna just sneak in one last question that came in. I can't believe this time is over already, but for those of you who are at or have worked at VC funded companies, can you talk a little bit about your relationship with your funders? How do you balance core clinical values with profit motive and the incentive to find your exit?
I deal with this the most, I think. I think it's really helped to remember that if you are working for, and this is just really blatant, but if you're working for a VC-backed startup, it's not a nonprofit. Just the structure of how those companies work and the way that your relationship with investors work, right? Like we are taking money in exchange for kind of a promise on a 10x return within a given time frame. And so I think like that's just the reality, and that's part of education going into these companies, I think. And I think companies can do a better job of onboarding, especially clinical science teams, to better understand like, how do we ensure that everything we're doing on clinical product aligns with business goals so that we hit our metrics so that we can get to the next fundraise? Like, I don't think that these things are necessarily at odds with one another. It's just you have to be very intentional and thoughtful with how you're structuring your business. So that incentives aren't misaligned. Like if you have a business model that depends on prescribing more and more controlled substances in order to hit your targets to raise the next round of fundraising, I think we all saw the news recently. That type of company is set up to have clinical completely at odds with the business objectives. So I think you just have to be really smart around what types of companies you're joining, and also like have the reality check with yourself that like everything you do is in service of getting those investors 10x returns, because that's just the contract in which these founders like myself are in with their investors. So that might be harsh, but I think it's helpful to just level set and like understand the reality of working within a VC-backed company.
Thanks, Arielle. Yeah, go ahead, Jess.
I worked at a couple of different stage companies at this point, and one company in particular was wildly transparent. And he was really clear, like there's certain ones he just didn't go with, right? We could have had higher backings for different rounds. And that's part of the role of the CEO and the COO, who's ever they get to pick. And if you're aligned with them, then it doesn't have to be this wild dichotomy between what they're wanting and what you're creating, just as academia doesn't have to, but sometimes a certain university is going to want like 10 papers that is unethical, right? So there can be misalignment of incentives on both sides. So being really careful of where you go either way, I think is really big.
Thanks, Jessica. Totally agree. And I know we're somehow at time already. This flew by. There are like 10 more really thoughtful questions in the Q&A. So I'll just say, take us up on the offers to connect on LinkedIn, to talk. If we're not the right person to answer your questions, at least I'll speak for myself. I'm happy to, share my network with other folks on this call who might be able to speak to, experience in that domain better. Thank you all again so much for attending. And thank you so much to our for sharing your amazing experiences. I'm leaving this feeling excited, inspired about where clinical science is headed in digital health. So thanks everyone, and enjoy the rest of the conference.